I almost dropped out of school because of money problems. My parents didn't work, and I had to sell tissues at traffic lights. Then I was taken to this foundation to be helped, so that I could go to school again. Children around the world had to earn money and feed their families during the pandemic. It's a worldwide phenomenon, and it hit Indonesia especially hard. Schools only reopened in early August after 55 weeks. Indonesia has the highest infection and death rates in Southeast Asia, and so the risk of children being infected is also very high. 141,000 people have died from COVID-19, more than 1,200 of them children. The very young are particularly affected. Hunger and poverty are rising sharply, and babies have little resistance to the aggressive Delta variant. Welcome to DW's COVID-19 special. I'm Daniel Winter in Berlin. Kids are often ignored in discussions about COVID-19 because most of them are less susceptible to serious symptoms. But a recent study estimates over 8 million children around the world have lost a parent or primary caregiver. As if that weren't bad enough, those kids suffer the knock-on effects of abuse or mental health problems. As Indonesia's COVID death toll reached over 140,000 this week, the impact on children there is particularly high. Social workers have raised the alarm, seeing increasing numbers of orphan children in desperate need of care.
What he misses most are the simple things, like going for a walk with his dad. 12-year-old Denas lost both of his parents in the pandemic. Today, his uncle joins him to pay tribute at the family grave. Life has changed radically for the boy from Tangerang, on the outskirts of Jakarta. He now lives with his older brother in their parents' home. Mohammed is 19 and does what he can to hold on to some form of normality.
You'll know what it feels like to be a parent. That was their last message. After saying that, a few hours later, my parents died.
The number of orphaned children in Indonesia is still rising, even as the pandemic in parts of the country slows down. The organization Save the Children Indonesia estimates that more than 18,000 children have been orphaned by COVID-19, losing either one or both parents. When the boys were vaccinated last month, the police in Tangerang learned about their recent loss. The police chief was especially moved and has since personally given the boys financial aid. The father of 6 has even offered to become a foster parent.
Kami kepolisian secara profesi, tapi kami manusia.
I'm a police officer by profession, but I'm also a human being with a heart that is touched. I can't just stand by and watch because I share the same destiny. When my parents died, I'd entered junior high school like Denas. Foster parents took care of me so that I could go to high school and become a police officer. Now it's my turn to give back.
Kami akan berikan lagi kepada orang lain. Jadi menjadi berkat bagi orang lain.
The adoption process is still ongoing, and Denas hasn't made a final decision where to live. But the boys are grateful for the support that is not tied up in red tape. Without state benefits, children in poorer areas are often sent to orphanages, as families don't have the financial muscle to care for them.
The problems these children face, however, go beyond material issues. Mental health plays a big role. And then there are legal challenges. Some relatives also put money into their own pocket.
To stop thousands of children from slipping into poverty, abuse, and neglect, it will take the joint effort of community members, healthcare professionals, and relatives. Mohammed is ready to do his part too, to help his brother cope with the grief and to make sure that he one day gets into university.
And joining us now from East Java Province's COVID-19 Control Task Force is Makian Jibril. So we've seen there some of the devastating things that kids have to go through. But from your perspective, from what you've seen, how would you describe the situation for kids in Indonesia?
Yes, Daniel. So basically today we have 4.1 million cases of COVID-19, where 140,000 of them are dying due to COVID-19. For the children itself, we have between age 0 and 5, we have 121,000 cases, or 2.9%. And for the age between 5 and 18, we have 424,000. So basically 10.1%. So around 13% of COVID-19 cases in Indonesia are from children below 18.
So how much does poverty or living conditions affect the potential for children to be harmed by COVID-19, even indirectly?
Well, basically, it's interesting that children who are live in poor area or living in the village which have low literacy or COVID-19, they are more prone to the infection because of, that their parents might not have access to the good healthcare information about COVID-19, how to treat them as early as possible. So in the rural areas and the poor area, usually the cases of COVID-19 from children are higher.
And we've seen that, according to the Indonesian Pediatric Society, more than 100 Indonesian children have died every week since July, have died from COVID-19. So why are children seemingly so susceptible to infections and deaths there?
Yes, I think it is interesting because at the July, Indonesia faced its second wave. The cases of the COVID-19 are soaring high. That the hospital occupancy in only 2 weeks, at the June, the hospital occupancy was around 30%. And then at the July, it's soaring high up to 80%. And the daily death of COVID-19 cases was around 1,500 cases. At that time, we have Delta variant who have really massive spreading and outbreaks and become the dominant mutation in Indonesia. And of course, with that rapid spread, the number of the victims, including from the children, are increasing rapidly. However, in the healthcare facilities, usually hospitals in Indonesia are more prepared to fight with the adult or elderly cases of COVID-19. Many hospitals are not really prepared yet for the children cases. So at the end of the day, the numbers of the children who are dying because of lack of facilities are higher.
All right, so it's a serious issue there, children being hit hard by COVID-19. But thank you very much for joining us and explaining us about it. That's Makian Jibril. Thank you very much.
Okay, thank you very much.
Well, now it's time for one of your questions about COVID-19. Over to our science correspondent, Derek Williams.
Are the viruses related to SARS-CoV-2 that cause SARS and MERS also airborne pathogens?
It took time and a whole lot of studies before healthcare authorities were certain enough to come out and state clearly that SARS-CoV-2 is primarily spread not just via larger respiratory droplets exhaled by infected people, but also via smaller aerosols. That's because the means by which a pathogen is transmitted can be a really complex thing to prove, especially when it infects others by hanging suspended in the air. But a lot of the evidence we have can't really be explained any other way, and studies have now made it the theory that most experts agree on when it comes to SARS-CoV-2, that it's transmitted from infected people to others via droplets and smaller aerosols, mostly indoors in poorly ventilated rooms, especially if those rooms are crowded and people spend long periods of time there. What we know about transmission in the coronavirus that causes SARS is a lot more limited because only around 8,500 people have ever had it. And all of them were infected almost 20 years ago. But experts think it's more difficult to transmit. The CDC says that the SARS coronavirus spreads mostly only through larger respiratory droplets during closer personal contact, either directly or via surfaces contaminated by those droplets. That and another major factor that sufferers are mostly infectious only when they have the full-blown symptoms of the disease. That helped authorities get SARS under control through strict quarantines. When it comes to MERS, we know even less about transmission than we do with SARS because even fewer people have contracted it, which means even fewer opportunities for study. But it's believed that people can catch it directly from animals, and camels are a prime culprit. A human-to-human spread is also possible through close contact, but as far as I can tell, no one has yet identified the exact mechanisms of that spread.